Thank you. Okay. Data provided by the German Shepherd Breeding Association shows that all of the German Shepherds that were x-rayed from 1998 to 2000, almost 13% of them had dysplasia at the time of their x-rays. This information is from the Bayesian analysis of heritability of canine hip dysplasia in German Shepherd dogs. This is from the Journal of Animal Breeding and Genetics. I work for a veterinarian and I see dogs with mild to severe hip dysplasia all the time, especially in larger breeds like the German Shepherd. They get so big and they work themselves really hard and it'll just tear their hips down, and there's a lot of reasons really that cause it. And I'm sure every one of you has had a pet at one time or another, and some of you may have even had one that had hip dysplasia. It is very important to know about hip dysplasia if your dog ever has it, and this way you will. I'm going to give you some basic information and background on canine hip dysplasia, tell you what can cause it, how to go about preventing it, and treating it if your dog has it. First, I'll give you some general information on hip dysplasia and tell you exactly what it is. It is potentially life-threatening for any dog that has it, and normally when you have hip dysplasia, you have a femur and your hip bone, and you have a ball and socket joint there. So the hip has the ball, the space for it, and the femur has the socket, and it fits together like this. And when you have hip dysplasia, it's out, and they're not together all the way. There's a space there because all the joints and ligaments that surround your hip and keep it in there have gone lax, and they're not as tight as they used to be. And I have an example to show you. I actually videoed this dog myself at the vet clinic where I work. And it's not a German Shepherd, but it would happen the same way if it were a German Shepherd, and I thought it was a good example since I got the information myself. This dog's name is Maxie. He's an Australian Shepherd Corgi mix. He's 7 years old. He's a neutered male. When the owner brought him in, he said that he's skipping when he walks on his back legs, and he appears to be in a lot of pain. It's been going on for several years, and it's slowly gotten worse. And here's a picture of Maxie from the top. You can see he's gotten thinner in his back end where he's lost weight because he can't carry as much weight because his hips hurt. Here's a video of him walking, so you can see just how bad it is. As you can see on his back legs, he's kind of skipping. There we go, and that's the end of that. And so we took an x-ray after we watched him walk. These are perfect hips that are exactly the way they're supposed to be in an x-ray, and these were Maxie's hips. And as you can see, he doesn't have exactly a ball and socket joint. There's almost no socket for his hips to be in. It's completely eroded, which probably due to genetics. It could also be a number of other factors. Here's very bad hips. Compared to the same perfect hips, there's very bad hips. They're not even close. They're completely separated there. And hip dysplasia will cause osteoarthritis, an altered gait, as you saw on Maxie, and it can even begin soon after birth, which it's not common, but it'll happen in a puppy and they'll have really bad hip dysplasia. As you see, this says OFA grade hips on the PowerPoint that I did, and that is the Orthopedic Foundation for Animals, and they grade hips on an A through E, kind of like in school, except for in school you only go to F on hips. Grade A is perfect, there's nothing wrong with your hips. B is borderline, but still considered okay to breed and everything. And grade C through E go from mild to severe hip dysplasia. The separation in the femur and the hip that you saw on this one, on the very bad one, is called a subluxation, and that information comes from Pet Education's article. It causes changes in size and shape of the bone surfaces. As you can see in this right here, the bone is shaped very differently and there's spurs everywhere as compared to the normal hip. Most dogs